And now starting us off this evening with an overview of CII CPAR is Sheena George, the CII CPAR Primary Care Lead with the AMA ACT team.
We're going to start off with our agenda. We'll have a high-level overview for what CII CPAR is, how it connects into your priorities as the Edmonton Zone, its relevance during COVID-19. We have 3 physicians and teams joining us today to share their stories, why they got involved, their experiences from signing up to going live on the system, sharing their data, receiving reports, the challenges they had along the way, and the benefits they've realized. We'll highlight where we are at today in terms of CII CPAR status, how you can get involved, then we'll end the night answering your questions. So let's start off with the real patient story. This is Wayne. He's our colleague Michelle's dad. He was a relatively healthy 80-year-old man with mild to moderate dementia and a long history of kidney stones. Wayne recently passed away, but his story is meaningful, and his family wants us to share his story in hopes it can help shape changes to our system. On the next slide, we'll look at his journey. It starts off with Wayne paneled to a family physician in a patient's medical home in Calgary. He had great relational continuity with his family doctor and a very high level of trust. His paneling information was recorded in the EMR. Wayne knew who his primary provider was. He knew his team, but this information stayed in the clinic. He was having pain, and they thought it was related to his kidney stones. So he was referred to a urologist, and it was for a simple outpatient procedure, a cystoscopy. The referral letter went out, the consult letter came back. In a few days, it looked like everything was fine and the procedure was completed. The letter said everything went well, except about 5 days after the procedure, Wayne ended up in the ER with weakness, confusion, and fever. Over the next 5 months, he was hospitalized, and he was hospitalized 6 times with UTIs, 2 of which was urosepsis. At no point as he's going back and forth to the ER was his family physician or his urologist, were they ever notified. Now, the ER doc, every time Wayne had presented, they had access to what was in NetCare. So they were able to see some DIs, some medications, but of course, there was no information from his family doctor's clinic EMR or the urologist. It wasn't clear that Wayne was already seeing a specialist. And when Wayne presented in the ER, he was very confused and he was unreliable in his ability to provide a history. The ER relied on his family. Each time he was discharged from the hospital, there was no follow-up communication or arrangement within the system. Again, this relied on family. When his family took him to his family doctor several months later, after the procedure had kicked off this whole series of infections, his doctor was shocked and actually quite upset. He had no idea what had been happening to Wayne. When he looked on NetCare, he was able to see that there had been multiple CT scans, multiple ultrasounds, but that was about it. On the next slide, let's talk about continuity. Wayne had great continuity with his family physician, but that continuity, that established, confirmed relationship, that information about his family doctor, that stayed in the EMR. There was no way for his family doctor to let the system know that Wayne was his patient. Continuity of care is how one patient experiences care over time as coherent and linked. This brings us into the context of what CII CPAR is. So hearing Wayne's story, we'd like to use that to set that context. On the next slide, we'll define what CII is. It's community information integration. What it means is information, select information, is pulled across from your community EMR into Alberta NetCare in the form of a clinical report. Information is also sent to the Healthcare Data Repository. It's a new database This database is governed. There are members from the public, patients, AMA, Alberta Health, and AHS. The purpose of having that information in the repository is for the first time to have the ability to look across the system for system planning. So what's CPAR? It's the Central Patient Attachment Registry. CPAR is the provincial system that's capturing that confirmed relationship, that therapeutic relationship between each family physician or nurse practitioner and their panel of patients. That confirmed panel gets uploaded on a monthly basis. It is monthly because panels are fluid. We know that as patients change, they're born, they pass away, as people come and join practices or leave, we need to be able to have an accurate sense of what that information looks like. The panel becomes a source of truth. This is the next logical step when you're looking at panel management, and it also is the next logical step for future enhancements. On the next slide, we're going to simplify what CII CPAR is. Really, it's about what family physicians and teams are sharing with the system, what reports they're receiving back, and how that sharing and receiving of data enhances what already exists in Netcare. It shows where CII CPAR can help bridge that continuity gap that exists in the system today. During the rest of this presentation, you will hear from your colleagues and how they shared their data, what they did with these reports, and what their overall experience was. But before that, let's revisit Wayne's story. So looking at his journey, what if his family physician and his specialist was live on CII CPAR? How might his journey have been different? So it still begins with Wayne having a family physician with that strong, trusting relationship. But now that relationship is reflected in the EMR and being able to pull back up. The physician chooses to participate in CII CPAR. That confirmed relationship that was recorded in the clinic EMR gets sent up to CPAR, and the panel is reflected in a monthly panel upload. Key information as clinic visits are also submitted, and these are now submitted to Wayne's Community Encounter Digest, a report now available in Alberta Netcare. The urologist also chooses to participate in CII. So now when Wayne has his consult with the urologist, that report is also submitted to his Netcare record, where now anyone in Wayne's circle of care can access, not just the referring family physician. The outpatient procedure, that could have triggered an e-notification to his family doc. This would have been an opportunity that his family physician and team could have had to reach out to Wayne and provide proactive care. Now, when Wayne goes to the emergency department, they too have access to key information from his encounters. And the ER team would have access to the urology consult report. They would have seen that he's already seen a specialist, and they would have been able to identify who the primary provider is. After the ER visit and upon admission to hospital, another e-notification will go to Wayne's family doctor. When he's discharged, an e-notification goes to the family doctor's office, and they would have had yet another opportunity for proactive follow-up with Wayne and to create a care management plan. In this scenario, CII CPAR bridged that continuity gap that patients like Wayne experience today. So what are some common CII CPAR questions? We often hear, what about confidential patient conversations? Are those shared? Do patients need to be notified that I'm participating in CII CPAR? And on average, how many e-notifications should I expect? On the next slide, we're going to go a little bit more into the privacy piece. Really important. When you're sharing data in CII CPAR, only mapped fields in your EMR will flow to Netcare. Next week, We're having 30-minute lunch hour sessions specific to each EMR that show you those exact fields and how they come across. If there's concerns and you don't want to share information you feel is confidential, we suggest that you map them, you document them in unmapped fields. You also have an opportunity to enable confidentiality features within each EMR. So the specifics about the EMR and how information flows across, again, is offered in our training sessions. So thinking about patient conversations, our health information, because Alberta Netcare or CII CPAR is a part of Alberta Netcare, we sit under that umbrella, which means the project is covered under the Health Information Act. So what is required is a health collection notice poster. You can have a poster set up, you can have something on your website, or even an advertisement that you have in your waiting room. There's no requirement to have direct patient conversations. An independent survey was done by the Health Quality Council of Alberta, the HQCA, and what they found was that most patients are not asking questions, and if they are, the questions are about Netcare. So let's look at the next slide to see some data. On average, we know that the number of e-notifications that come across 7 days a week for 1,000 patients on a panel is about 11. On average, daily, a physician could expect 1.5. And this data is as of May 2020.